Our society models popular beauty standards through the fashion industry, which provides images to youth and adults, which impacts people's satisfaction with their own bodies. The research shows that as many as 1 in 5 women overall have an eating disorder or disordered eating. Another study found that over half of teenage girls and a third of teenage boys use unhealthy weight control behaviors such as skipping meals, fasting, smoking cigarettes, vomiting, and taking laxatives. This is at least partially attributable to the images which are shown demonstrating popular fashion. The Girl Scouts of America surveyed teenage girls in the United States and found that 75% rate fashion as really important. Almost 9 out of 10 feel pressure to be thin. And celebrities and role models influence girls' self-perceptions more than parents or friends. The average American woman is 5 foot 4 inches and weighs 165 pounds. The average Miss America winner is 5 foot 7 inches and weighs 121 pounds. Our youth are noticing these trends. A 2007 study found that around 40% of models may be affected by an eating disorder. Models are often subjects of scrutiny on the job. Many are belittled and called fat. In the fashion industry, models who struggle with eating disorders are often not given appropriate medical care. In most industries, when employees suffer significant illness or injury, which is directly attributable to the job conditions, they receive workers' compensation and medical care. However, models often just get fired. You may be asking, what is an eating disorder? Basically, someone may have an eating disorder if they don't eat enough, if they eat too much in a short period, or if they purge through self-induced vomiting, overuse of laxatives, or overexercise. While anorexia, eating too little, is perhaps the most famous eating disorder, bulimia, eating too much and then purging, is likely the most prevalent. Relatively few national brands are doing advocacy work to raise awareness about eating disorders. A few, including Dove and Aerie, are campaigning about body positivity and are encouraging anyone with eating disorders to seek professional treatment. These positive messages could be pivotal in decreasing the number of people affected by eating disorders.
Eating disorders have the highest morbidity rates of any mental health disorder. I almost lost my close friend Anne to bulimia. She had struggled with bulimia for over 8 years, and one night her electrolytes became so imbalanced from her repeated purgings that her heart went into cardiac arrhythmia. About 2 hours later, her roommate found Anne unconscious on the floor and called 911. The medics rushed Anne to the emergency room, and the doctors were able to save Anne's life that night, but they said that Anne would have died from cardiac arrest if her roommate had not found her when she did. Anne was admitted for inpatient treatment. This was the first time she'd agreed to receive professional care for her disorder. Those suffering from an eating disorder often die from medical complications of the disease, such as heart failure, organ failure, malnutrition, and sometimes suicide. In a 2009 study reported in the American Journal of Psychiatry, the mortality rates for anorexia and bulimia were each 4%, and for eating disorders not otherwise specified, the mortality rate is 5.2%. These are complex conditions with a variety of causes. Once started, eating disorders become a cycle of physical and emotional destruction. The earlier professional help begins, the better the chances of recovery. Cognitive behavioral therapy, in combination with an SSRI, has shown to reduce bulimic symptoms and may reduce relapse at 1 year. In acutely underweight anorexic patients, weight restoration should be the first focus of treatment. Although cognitive behavioral therapy and interpersonal psychotherapy are typically used to treat anorexia, unfortunately, no single therapy emerges as effective. In addition, no medication for anorexia has been shown to increase weight or improve psychological features of the disease. This year, France joined Israel, Spain, and Italy in banning ultra-thin models from working in the fashion industry. The French legislature voted in favor of a bill that requires models to have a BMI of at least 18. Modeling agencies in France will face up to 6 months of jail time and a fine of $82,000 if found using models with a BMI under 18. These countries are attempting to stop the idealization of being dangerously thin in hopes of curbing anorexia in the fashion industry and in the public. French model Isabelle Caro died in 2007 at age 28
from
Before she
anorexia.
died, she supported an anti-anorexia campaign by having shocking pictures taken of herself showing her emaciated body. Join others in promoting companies like Dove and magazines like Health that use models with healthy BMIs for their ads. And tell your congressman or congresswoman that you support legislation in the U.S. to restrict models with BMIs under 18 from the fashion industry. If you know someone who has anorexia or bulimia, be sure that they get help. Healthy BMI does not necessarily mean you're not suffering from an eating disorder, but it's a start in the right direction. It's an important message to women and girls who see models in magazines and TV as examples of perfect appearance.